So, good afternoon and welcome to the afternoon session for the MediWales NHS Collaboration Conference Connects. It's a beautiful day, so thank you for coming inside just for this period to join us to view a presentation that I've really been looking forward to for some time now, but I know is new to a lot of our delegates. So this workshop is on learning from the pandemic, the NHS Wales COVID-19 Innovation and Transformation Study. Now, I know that it's a study that has been conducted over the last couple of months, and an awful lot of work from the innovation teams across all of the health boards has gone into this study. And we're lucky enough to have Sean Charles and Tom James to present the work. But I'm sure Sean and Tom will be the first to say that there has been a lot of effort and a lot of input from across health and social care in Wales. So. We are having a few technical issues with Tom. He's let me know his Wi-Fi is down, but I've just turned on the screen and I can see him sitting there. So I think, we're in pretty safe hands if I hand over to Sean and Tom and you take it from here. Would I be right, Tom?
Yeah, that's fine. Thanks, Gwyn. Cheers. Once again, Sean's going to be sorting the slide deck out. It was a bit of a touch and go moment with the Wi-Fi went down about 5 minutes too, but yeah, we got it back. We pulled it back around. So thanks for bearing with me on that one. Now, some people will have seen the presentation I made, which gave the kind of full detail really on the study that we've been doing over the last year across the NHS in Wales to understand, and capture some of the key learning, innovation, transformation type examples from across the NHS in Wales, in which we picked up the learning from the pandemic, I guess. For those people who didn't attend that session, we'll just run the video very, very quickly. And what we're going to do in this session, just give you a minute on what the actual study was, but then we're going to try and get some audience views really in terms of what their views are alongside the key themes that have come out of the report and trying to get some further detail on it really. So this is designed to be an interactive session. We really want to understand whether people kind of agree with what has come out of the report, or we disagree, but just to put some further detail behind it really and get some further information on it, as well as anything that maybe hasn't been covered. So Sean, if you're able to just pop the video on again, that'd be great.
Sorry, this is I'm missing buttons in my enthusiasm to put things on there.
It's all right, Sean, we can always take that out in the edit.
The COVID-19 pandemic has meant health and social care systems in Wales have faced an unprecedented challenge. However, during a crisis, people will do new and innovative things that they have never done before. We look at issues differently and take instinctive action that challenges the usual ways of doing things. The NHS Wales COVID-19 Innovation and Transformation Study has captured the learning so we can better understand the changes currently taking place throughout the sector. The aims of the innovation study are to understand the reasons behind the application of new practice and innovation during the pandemic, demonstrate an inherent permission to implement transformative change, communicate how we can apply practical real-world examples to other areas, highlight NHS Wales as a leader in innovation and new ways of working. Other themes discovered in the report include implementation of new ideas at pace, collaborative partnership working, remote or restructured service delivery, innovative use of new technology or products. We hope the report will encourage positive and meaningful changes that will benefit the people of Wales. Through collaboration, innovation and transformation, we can achieve a healthier Wales.
So that will have given you a very succinct introduction to what the study is and has done. The reason Sean is with me today is that whilst I've kind of kicked the report off from the NHS end, Sean's been really, really heavily involved in the actual production of the report from an Arch and a Swansea University perspective. So him and I are going to do a bit of a double act today, just to talk. We're going to talk through very, very quickly some of the key themes that have come out. I don't want to do it too much because it'll be repeating what I did earlier, but as we said, we really want to get views from people here as to, you know, what does this chime with their own experiences? Does this match what they've been feeling? Have they got additional comments to make? So I guess the first thing, point to bring up, the first kind of priority theme that was coming out of the report was around accelerated decision making, and this generally was about how decisions were made much more quickly, how this enabled staff to do different things, you know, how this capitalized on a momentum across the system to change and transform, and a kind of a fear or a risk, if you like, of returning to the old ways of working. Is this something that the audience have picked up themselves? And Gwyn, I'm just wondering about the best way to handle sort of queries and comments. Is that to kind of come through yourself, or is that to go through the chat bar? How would we like to do it?
So if people could put their questions in the chat or the Q&A, we will pick them up. We'll try and provide a bit of triage. If there's time at the end, then we can open it up for people to open up their cameras and mics and discuss topics in them in person. But other than that, we'll make sure that the questions are picked up in the chat and relayed to you, Tom.
Okay, yeah. So this, Sean, being part of the evaluation team, and obviously, you know, as a member of the NHS, you know, a staff member of the NHS, is this something that you've picked up yourself as well?
Yes, quite a fair bit of it. You know, there's things that people might have imagined would have taken 2 or 3 years were done in 2 or 3 days or 2 or 3 weeks. I think there was a strong level of urgency within. So just to give an example that I bumped into, within Hywel Dda and Carmarthenshire County Council, they were able to make arrangements for childcare and collaborative arrangements between the local authority and the health board within 2 or 3 weeks. When normally you might have imagined it would have taken you 2 or 3 months just to get around the table to talk about it. So there's that sense of urgency that certainly played through in various experiences.
Yeah, particularly a staff member who you guys will probably know, Professor Sue Bale, reported that, you know, they got COVID trials up and running in a matter of days, and I guess, you know, with a global pandemic creates that sense of urgency, you know, which it would have taken 6 months to get a trial up and running, you know, particularly a trial of that size with that many patients and with that many different factors involved in it. And actually that was picked up very much during the news article that the BBC Wales ran on, you know, what happened during the pandemic, but also how this plays into NHS recovery, particularly in terms of how we can use technology to be more resilient and to adapt quickly to these changing circumstances. Are there any chat questions that have come through on this point, Gwyn?
No, we're still, I think everybody's just warming up, ready to fire you with questions at a later stage. But yeah, we are monitoring the chat.
Okay.
I'm very interested in personal experiences of this. You know, clearly the questionnaires, the surveys, some of the narratives and people's experiences we've collected have led us to a place where there's a fair bit of evidence emerging from the data that this exists. But on a very personal level, members of the audience, did you see accelerated decision making? Can you share an example?
So if you want to, in addition to using the chat, you can also put your camera on and raise your hand. So we have everyone in front of us at the moment. Everyone has politely got their cameras off. Either that, or they're viewing from the garden and they don't want people to know. But please do turn your camera on, and we'll know that you want to engage or just ask questions in the chat as normal. So yeah, feel free, and we'll keep an eye on that for you, Tom. And Sean.
Thanks, Quinn. Well, just a personal reflection at this point, maybe. We talk a lot about complexity and chaos when we're looking at innovation and change and that kind of thing, in terms of how you interpret some of these things and what they look like in practice. But the interesting part of accelerated decision making is that often decisions are made based on very little data, so one of the interesting features of fast change has been that when we're not entirely clear yet what the effect of some of these things are. So we occupy a space that that qualifies maybe as chaos on this point, because people have taken action where it's difficult to establish what the effect is, and where when it comes to thinking about how we can make use of, or how we can increase instances of accelerated decision making within the NHS, we probably need to be mindful of the fact that sometimes the speed of decision making can lead to unforeseen circumstances, and how therefore we're able to hang on to that idea and identify ways of evaluating the effect on an impact of actions would be quite interesting.
Yeah, I mean, I think for me as well, there's the counterbalance to the side of accelerated decision making, and which was coming through strongly from respondents, which was saying they didn't want to go back to the old ways of having to take a long time for decisions to be made, or to have to go through quite long or laborious processes to get that done. And is that something that you've felt yourself, Sean, in these set of circumstances? I suppose you've been part of the Bevan Commission, so it's given you that more helicopter view in the past of it. But is that something that you've seen, coming back into the NHS, if you like?
Definitely. I imagine that features of NHS control have been playing out within change for the last 12 months or more, even against a backdrop of accelerated decision making. But certainly, as we start to move forward, I'm experiencing personally a stronger level of governance coming back in. This sense of uncertainty and flexibility within the system is great for a while, but maybe we do need a little bit more structure to decision making. And I think the interesting part around that is that people are finding it frustrating to go back to a state where decision making can be a little bit more difficult, and I'm seeing a fair bit of that myself. But they're also carrying with them, I think, a sense of agency, and they've seen what can be done. And so it's difficult, I think, to put people back in the box once they've experienced that sense of ability to act and freedom. And I think it'll be great to see how we can maintain that level of agency within different staff groups and individuals.
I think here as well, that there's a point to be made about people making the decision. So people who are providing a particular service making the decisions for that service, not having to go to other people to make decisions on their own service. So if there's a kind of, a physiotherapist making the right decisions for how to provide the services, rather than having to go to some sort of a board that sits somewhere else to request a decision on something that they know more about, or they understand better what their patients need. There is a comment that's come into the box of myself and Lynn Jones. Do you want to build on that, Sil?
Yeah, hi there.
Hi
Hi. I was working as a speech and language therapist in Rookwood Hospital in Cardiff when the pandemic struck. And I was just thrown into sort of the deep end with everybody else on the front line. And yeah, it worked really well within our team that we, it felt like the hierarchy just went overnight almost, and everybody's ideas were listened to, and we were given the chance to try different ways of working out, and if it didn't work, we'd go back to the drawing board. And there was a real sense that COVID enforced that really situation on us, but it worked really well. But so that was within my MDT that it worked within really well. But where I felt it was a bit more problematic was that I was managed by therapies, and that hierarchy was still very much there, and decisions were being made at a higher level, and we were sort of told what to be doing. And I found that much, much more difficult in a situation where I was anxious and clearly, going to work every day, not really knowing what the risks were at that point. I think that communication was key really in getting people on board, and getting rid of that hierarchy within the MDT was brilliant. Like I said, I also experienced where the hierarchy still existed, and that caused quite a lot of problems.
So what are your views on kind of going back to the old ways of, or the old ways of doing things? I'd really like to get into the skin of that a little bit more, if you don't mind.
Yeah, I think within the team in Rookwood, it's definitely like brought us closer, but also I think, there's an element of burnout actually, that people feel that there's a need for a bit of rest and recuperation now. I don't think that appetite for like constant change, you can't maintain that long term. I think, it kind of, for me at least, it kind of happens in bursts of energy. And I think that initial kind of initially with COVID, that's definitely what it kind of gave us all that energy to make those quick changes. So for me, it's more about like, well, how do you get that balance between, allowing people to have a bit of, a sustained kind of time when there's not too much change going on, intermixed with bursts of energy. I think I certainly that's what my sense is at the moment from the front line, is that, and especially after the second wave, it's just that like we need a rest now. We need to kind of get our batteries levels up again before we can face any new changes again.
Yeah. No, that's interesting. We'll hold that thought if you like. And what I'm getting a nasty echo. If we can move on to the next theme, that'd be good. Just because we have the time really.
Do you want to jump through 2 slides next to this one, Tom?
Yeah, go for it.
Yeah. This is the next one.
So staff well-being was a particularly big issue, I guess, and I think it absolutely picks up on the point that Silta's just made around a feeling that people were sprinting, a feeling that people were just kind of pushing themselves into, having to work in situations they were completely unfamiliar with, having to work with a lot of uncertainty, particularly in relation to their own health, but also in relation to, to maintaining their own health alongside very busy workloads, having to kind of experience, a whole range of particularly difficult circumstances. And I think that, what the study has brought up is that there were more interventions noted around staff well-being. However, were they the right ones? Is a wider range of interventions, sometimes much more targeted to specific clinical groups needed, especially those working on the front line who have had to sort of see and do things that I think none of us have really, or certainly, I'm very, very fortunate not to have as a non-frontline member of staff, but it's very, very difficult to imagine what it's like to have been told or telling people, that they haven't got long to live, or having to kind of FaceTime family members, to say goodbye, those types of things. And I think, how do we provide the right sort of support to the front line in particular to do that in more accessible ways, recognizing that it's not easy for an A&E consultant to kind of do a lot of these things, because they have to take time out of a very busy clinical role to do that. So it'd be really, really interesting to understand the views of the audience a little bit more on staff wellbeing. What, if more, needs to be done, or what kind of good stuff we saw, what stuff that still needs to be done, etc. Is that, Sean, is that something that you've seen firsthand, or you've experienced?
Yeah, I think it's been a very interesting reflection for me, really, on people's response to these things. And I think Esse's point was really well made, around how people feel around around continuous processes of change and uncertainty, because we all respond to these things differently. I was thinking while she was speaking, if a day in work for me is the same as the day before, it's a very unusual day. Because everything that I do is usually about change or changing something or another. But often maybe it's not about me changing. It's about other people changing. I'm doing the same thing. I'm helping people change. So how that can affect somebody long term is really interesting. I think the big question for me comes back to during processes of change, which we see a lot of supporting change and innovation projects. People go up and down. They feel great, they feel terrible, they feel great again, and so the questions for me are much more around how can we help people to feel great when they're not feeling great, and if they are feeling great, how do we keep them there? And I'd be very interested in audience reflections on that kind of thing. I mean, I can share some of our experiences, but I'm conscious that I tend to echo a little bit for myself.
I guess the question is, Sean, do we start picking names out of the audience members? Do we give us in that regard? I
don't know, Mark Griffiths, I recognise.
Let's see if he's still there.
And maybe Steve, if you're still there as well.
I mean, we definitely know that Gwyn's there. Gwyn, have you got any?
It does feel a little bit like you're talking to an empty room, Tom. So if anyone is listening and would like to just turn their cameras on so that we can talk to you. I was trying to pick up on, I sometimes there's only first names available, and I was trying to pick up on people who've got a health and social care role, because obviously our industry colleagues are interested in what the developments have been as a result of this report. But clearly at this point in the conversation, you were just trying to pick up on health and social care workers' perspectives. So yeah, if anybody in the room would like to turn their camera on, then that would be great. But at the moment, everyone's quite comfortable in sitting back and letting you guys do all the work. So Steve has now turned his camera on. Thank you so much, Steve.
You owe me one for this, Sean.
I do, yeah.
Just to say, working, for those that don't know, I work with Sean in the arch thing, but as many were redeployed into various roles, I was unfortunate to sort of be a link between what is the Go command and then one of the units. So trying to feed back between the two elements of the hierarchy and the unit goal itself was a difficult a difficult situation, one for the unit because they couldn't get the messages across because there were conflicting messages coming from NHS Wales and Welsh Government coming down. So the pressures were on the hierarchy to implement some of those. The units were feeling that pressure on the ground, and then just trying to relay sort of some of the changes that went on within the unit and the costs, of course, that came with those. Trying to relay those back to the Go command as to what was going on. It became very difficult to monitor that. From the well-being front, you could being in the units, meetings 3 times a day at the height of the pandemics, you could see the stress, the strain on the teams as it was coming through, as the wave was coming, and almost a sense of relief as the first wave didn't materialize into what was feared to be the worst expectations. Unfortunately, by the time it came to the second wave, that same structure was different. It was in Swansea anyway. And therefore you didn't get a sense of the same feeling or what was impending doom on the first one. The second one, it was, we know it's coming, it just may be bigger, and we know how to deal with it. And they were more seen more robust in what they did. They acted a bit quicker, and they were more decisive on the ground, I think. And those mechanisms that were difficult in the first instance, in the first wave, were much more slick second time round, and that panic wasn't there. It wasn't evident to me anyway.
Yes, thanks for that, Steve. I think Gwyn, you made a really, really useful point just then, is that we have looked at this purely from a health and social care perspective. And I'd be really interested actually in some of the views from an industry perspective on some of this stuff, just to understand, with the same types of issues encountered, did they feel the same things? What were their reflections on working with, was it easier to work with the healthcare system during the pandemic? So just to kind of understand those aspects of the because there's learning from all the sectors in around COVID-19. I'm just wondering if there's kind of more specific stuff that we could look for from industry as well.
Absolutely. And Richard Brain, I can see that you're online and you turned your camera on. So maybe I can give you a minute to gather your thoughts, and then maybe you can reflect on what it was like working with health and social care during the height of the pandemic. I mean, my personal reflections were that I was seconded to the team who were made responsible for triaging all those offers, opportunities, and requirements around PPE and diagnostics. So I did feel that I felt the urgency, and I felt the need to work the stupid hours, and to just get up and get the job done. There was obviously a critical need for equipment, and which made life very simple. You got up in the morning, and you knew what you had to do that day. You had to manage as many of those product calls, product opportunities through the pipeline as you possibly could, and you did that until you went to sleep at night. So I think in some ways, Sean, what you were saying, I think my life became very simple during that process, and then I think for other companies, I think maybe it was a little different, because they were dealing with trying to pivot their services and their products to meet the new demand and the new processes. So I think it was probably different from a lot of people's perspective. So Richard, sorry, have you got your thoughts gathered now? Are you able to turn your camera on?
Not so much of a thought gathering perspective. It's just the camera shy I've been on twice today, so
you're very welcome.
I think from our perspective, it's looking into the healthcare sectors. We're finding that it's difficult because everyone's so busy, because the general feel from NHS and healthcare sectors is obviously there's a pandemic going on, which we all appreciate. So no one's really got time necessarily to get to say from my perspective, a demonstration or sort of have a chat, a bit of an education perspective of the products that we offer and why we offer them. I just wondered, I did type a question, but you called on me before I could send it, so I'll just read it out quickly. And my question was to the panel, and it was just, do you think working from home has impacted accelerated decision making, and how has working from home benefited the panel's ability to make decisions without the sort of general office distractions of people popping in and asking, questions that maybe aren't as important as what you need to be doing, essentially?
Well, I'll jump in on that one. So whilst working from home, I haven't got people popping in to the office or knocking on the door. I still do get that a bit. I've got smaller people doing that, and smaller people won't go away until they've been fed or had a drink and stuff like that. So in that regard, it is. I think for me, the boundaries between work and life have become really blurred in lots of cases, and you can be working later, but you can be working at different times, and you can be working. You start working, then you stop working, then you start again, which is, and I'm not. I can't make out if it's made me more productive or not yet. I can't see a massive difference. I just feel, but I do feel there's a blurring of it, if you like, and I think. For people who are running the healthcare system, I mean, I know, like some of our execs also had some of those, some of those distractions that I'm talking about, and so it can't have been easy for them either. Although I would say that the structures the decision-making structures seem to be flattened, and I think I welcome that, because it felt like stuff that was moving through, at the pace that people wanted it to, rather than having to get caught up in this kind of layering exercise. So that would be my reflection. Anyone else?
I think Steve Evans has just made a comment in the chat that it might be Steve. Are you able to turn your camera on, or would you like me to? Yeah, there you go. So, Steve, are you talking with your microphone muted, or you're not?
Schoolboy error, Gwyn.
We've all done it.
Yeah, it's just to say basically that industry did come forward within the early days, mostly with PPE, but there were the wonderful inventions as well. One was a ventilator, I believe, but with offers of help. But there was this issue around, is it of high enough quality grade to use in the medical environment? And sometimes the desperation was there to use some equipment, and that message of do not use it just came too late, and people were using some of these things. So yeah, just a comment around that, really.
Yeah, we received 2,500 offers from industry when a call went out because of a shortage of PPE and diagnostic solutions in particular, but also ventilators and later on CPAP machines, as it was realised that they were a better, less invasive solution. Yes, it was a case of managing a tidal wave of people offering technology, but some of it just not over the line in terms of CE marking, safety, and regulation. And there were some quite heated debates going on in the peak of that demand as to whether or not the demand for PPE should trump the need to make sure that PPE was certified and safe to use. I think a lot of people have very different views on that, and there was a need to tread a tightrope in that respect.
So Gwyn, am I right in saying that that exercise that you went through with the Life Sciences Hub and NHS Wales Shared Service Partnership, which is incidentally a case study that we want to bring out for the main report in April, because I think that's a fantastic example of collaboration, work with industry. There's a whole load of things in here. But am I right in saying that industry portal that you set up then is a kind of a lasting, is a legacy that is a project that will live on after COVID that we could apply to other areas?
So, to my knowledge, yes, and I have to put my hand up and say that my secondment to that project and to the hub was completed. So now I'm back firmly installed in MediWales, but we do obviously carry on engaging with the hub. And as far as I know, there are plans for the portal and for that for the learnings that came out of as a result of that process to continue. And I was just looking for Matthew Krolak, who was definitely one of the people in the room when we started this session, because he was the only person from the hub in the room that I thought might be able to comment. But maybe if Matthew pops back up, we can ask him. But yes, as far as I know, there are plans to capitalise on those learnings.
I have two quick reflections before we move on to the next findings. I think the first, in answer to Richard's question, I'm not sure that I've noticed an increase in innovation or this kind of practice because of working at home. But what I certainly have noticed is that, and this is through a number of projects and work that we've done around supporting people with some of their transformational change, is that people have transformed the way that they work, but they don't think of it as transformational change. They think of it as responding to operational pressures, right? So there's so maybe there's something interesting there around framing some of these things, where pretty much most people that I bump into are either working at home all the time, or they're working at home much more of the time than they were, and that is a significant change within the delivery of health services. And even that in itself, I think we should recognise as a major achievement in our ability to adapt quickly to different pressures. I think the other part then, going back to the staff health and well-being, one of the things that we've done with some of our exemplar projects of late, which is leading to a bit of a research paper, I hope in the next couple of months, is to measure how people feel across a period of time during change and how that varies. What causes people to not feel great and what causes people to feel great. And some of the things that really help people bounce back off the bottom of the page when it comes to feeling really bad are connections to others. So things through network events, feeling that they're being supported, and that they're not being thrown to the dogs if they're getting things wrong. Feelings, being able to access training and skills development when they need it, which again has been a key factor in our ability to respond to the COVID threat, and that general kind of ability to come together and share experiences that we've run as programs, but we don't see so much of within the NHS. And opportunities like this, maybe to listen to other people's stories and realize that we've all been doing something similar, but experiencing it something different, and to share how we responded to it, all contribute to bouncing people back up into the feeling positively about things. So there's a lot of stuff that I think that we could take forward into the future and introduce into general working practice. Whether this is the NHS or private sector organisations, people are people, and they're all responding similarly to the same kind of challenges. Yeah, should I hop on to the next slide very quickly then?
Yeah, let's do it.
And 3 this time, I think.
Yeah, no worries.
Yeah.
Okay, so this theme was about the use of resources and how we have used them in a much more agile way. Particularly reallocation of resources, and I guess in the main how we move people to priorities. In a slick way as we possibly can. This is something that has been. It's been an interesting one for me, this one, because having come from Welsh Government, to work for the NHS, and I've noticed that the NHS is huge. We talk about the NHS Wales as a microcosm of a much smaller UK NHS, but actually we employ nearly 90,000 people in the NHS. I mean, it's like much bigger than any other private sector organisation that exists in Wales. And so I guess we have such a huge amount of staff resource in keeping people well and keeping people out of, and then treating people when they're not well. but I guess it also feels sometimes that because of the size of the NHS, there are such different range of services that we provide. It doesn't feel that staff can move between these or move to priorities particularly well. And there was a very much a mixed bag really in terms of people saying that yes, we did move staff to priorities well, but no, we didn't. And I guess the next logical step of that really is that the report will say that more streamlined models should be in place to move staff to key priorities in the future, or to move staff around as we need them to, to inform business continuity, but also to inform continuous improvement. And that may not necessarily mean permanent staff change. It might mean giving a little bit of time to a particular project where there was an organisational priority to do something about it. Sean, is that something that you've picked up as well?
Sorry, if we pick these up, Tom, we can roll in then to the final conversation.
Okay, yeah. Well, I mean, the other part of this, or the top point here around sustaining the pace of innovation and change is that, people talked a lot about the COVID-19 platform that exists, and the platform to do different things, and or the pandemic creating the circumstances and creating the environment to do different things, or to work in ways that or to change services that were needed based on what has worked or based on what they felt was needed, and digital access and confidence, and the uptake and usage of digital technologies by staff, not just internal working and communication, but also to provide services to patients, attend anywhere, run by our technology-enabled Care Cymru team, digital appointments, online appointments with your doctor, phone appointments, things that really wouldn't have been sort of considered in the past, and now becoming more and more prevalent. We actually, in an Iron Bevan, we worked out that we saved, between the period of April to November, we had saved nearly 60,000 patient journeys to hospital through the use of digital and telephone consultations. And I mean, actually, that's, but before there was this constant push about services by default as opposed to digital services by choice. So I guess tried to wrap those 3 points up together there, Sean. Anything that you wanted to add to that?
No, I think the next point coming up then, embracing new technologies, is probably linking into that. But as ideas, I think the agile use of resources from a change and change management perspective is key. Because like Steve's experience, like your experience, like Essex experience, and probably Richard as well, and Gwyn, we've everybody changed jobs. Within my work over the last 12 months, I took face-to-face sessions and I put them online, and we basically rebuilt things from scratch. So we were doing things differently, but the nature of adaptability when it comes to supporting in innovation and change can't be underestimated. So I think the agility of the workforce, then going back, and if I connect this back into accelerated decision making and governance, right? The barriers around people's roles changing and moving around was temporarily removed. Yeah. So you get that fantastic ability to shift and move within that space. Whether and to what extent you can maintain that agility against a background of job descriptions and roles and banding and all this other stuff that we've got within our organizations is actually going to be a bit of a challenge, I think, for all organizations that have been looking at how they operate, and how we maintain, because as the progression through careers and the mastery of different subjects that people across the private sector and health in particular acquire through experience, training, education over a period of of a lifetime is really quite a challenge, I think, in this context of agile use of resources. Any particular thoughts on that, about how we could maintain agility within our systems and adaptability? Did anybody experience role changes themselves? How did it feel? What happened?
So there's a comment from Steve in the chat again. He says that he's been trying for many years to move staff patients over to the digital platform, and COVID has forced the move, and now look at us, smiley face.
Yeah.
So
here's me driving into the office to sit on a screen.
Some people are just resistant to change, aren't they?
Yeah.
One of the things that did come out was that those teams that had and I guess, you know, it picks up on Steve's point, really. The teams that had already kind of geared themselves up before the pandemic to use services were more resilient than those that weren't, and I think or were able to adapt more quickly. So I do accept the point, really, that, you know, we've got to be able to how we use the platform that is COVID to really make some changes that we know were needed. And I mean, you know, that the NHS is a traditionally seen as a slow adopter of technology and a slower adopter of change. But on the other hand, you know, the NHS has also made some of the most fantastic changes to its services within such a short period. So it can change when it really wants to. So I think for me, it's really important to kind of make sure we keep that momentum going and use this as a way, as an opportunity to factory reset some of the traditional ways of working that we've had, and just even if we try something new and it doesn't work, then we'll, you know, it doesn't have to stick, but, you know, to look at what other people are doing and to take that on. Any reflections on the private sector on that one?
Again, I'll ask anybody who wants to turn their camera on to join in on that. But in the meantime, I would just say that the work that you've done in producing this report, Tom, is really important, and Sean, I think one of the things to point out, probably from the private sector and from the public sector, is that we need to capture the voices and the experiences of the people who aren't being so vocal. I feel like there were people who had exciting jobs to do. They could be bad jobs, they could be good jobs, but there was a lot of change, and they were pushed out of their comfort zone and into new roles, and we gather a lot of data about their experience, in the same way as Sean and I have just relayed the fact that our jobs changed for the period of the pandemic. And but I think there are a lot of people, because of the working from home, because of the digital nature of our work, a lot of people went quiet. And because they were getting on with their job, not because they were doing nothing, but because they were getting on with their job, but that didn't include them being at events or in networking activities. And I think one of the things you're doing with this report is and this activity is really important to capture those feelings, because there's a lot of really important work gone on that and maybe people weren't so comfortable in dealing with this change. We have we have another comment from Esil, saying shared decision making is key in sustaining change in the longer term. So how does the shared decision making change as a result of where we've been?
I mean, I think we picked up some of the points around shared decision making a little bit earlier on. I guess for me, you know, there's a balance to be struck between trying to giving the people who are doing the job the most, who understand their patients and understand their services, giving them or empowering them to be able to make the right decisions for, you know, for their own, or how to provide their own services. And for me, and I guess that recognises that there are different, patients have different needs as well. Busy employed people like ourselves have different needs than, older people or younger people. And so being able to provide services in a different way and giving people a choice about the way in which services are provided to them, I think is important. And again, the point I made earlier or my earlier presentation about, as things become more modern and up to date, they become more flexible around people's lives. And for me, some of this around, or how healthcare can work around my life more, and how I can use my phone to manage my own health, it becomes more and more and more important. And I think that will be a theme that you get into tomorrow in terms of the digital work. But actually, I manage everything else in my life on my phone. At some point, our healthcare needs to be managed on our phone as well, and we've got to be able to do that in a way that, if and just looking at it from a Welsh point of view, it's all got to be in one place. Whether it's an NHS Wales app that is an umbrella app for a whole range of different other apps, if you like, there's something to do with physio. It might be for me as somebody who plays football. I can run physio. I get physio support through that app, but it might be someone else who's managing a diabetes condition or COPD. How I guess having an umbrella that can link a whole different range of healthcare advice and services and management pathways would be the real way forward in supporting people to manage their own health. Interested in other thoughts on that from anyone else?
I think if I pick up very quickly on notions of shared decision making, and maybe a different word for this, and this come up a lot in conversations today, has been collaboration, right? In some sense, I think I heard stories. I mean, for us, I'm always trying to share things with other people anyway. But I hear examples of where there's been greater amounts of shared decision making and participation amongst practitioners, and in particular where consultants and various other people who might not have been as open to shared decision making in the past have been listening to nurses, occupational therapists, dietitians, etc., a fair bit more. I think from an industry and a public perspective, the nature of shared decision making is to increase the variety and potential and possibilities. And I think that a thing that we could do as a way forward within the NHS is to do what we've been banging on about for quite a while, really, which is about bringing the patient's perspective in, so that we know what people actually want or need as we design services. But also, I think there's an incredible opportunity to draw private sector brains and experiences into this conversation a fair bit more, as we look at recreating services for the future. So in this space of continued fluidity that we experience around how services are delivered, I think that kind of insight into shared decision making would be incredibly valuable to draw in.
Yeah.
Open for business. Tom, if I could just reflect a little on today, you mentioned tomorrow's our digital session of the conference, but I also have to say that this morning we had a real insight into a number of the projects that were that have been adopted or have been developed, possibly during the last year, either because of COVID or regardless of COVID. They've still managed to get through. Chris Sube at Betsy, his patient-powered safety use of data and applications in order to empower patients to help manage their own conditions was just was an excellent example. And then using digital resources, Owen Hughes from Powys also gave another really good example of pain and fatigue management. So whether it's because of COVID or whether it's despite COVID, the use of digital tools is really coming into its own. Although one slight warning was from just Rob Salter from Cwm Taf Health Board also mentioned that currently they've got 160 digital active IT projects running in Cwm Taf at the moment, and so and there is a real need to make sure that these individual projects have some interoperability, some connectivity, as you said, Tom, working in one system, so that you don't have 160 different data sources or platforms that you have to log into. So it's definitely an exciting time and something we will be picking up on tomorrow, but definitely some challenges there as well.
Yeah, well, I guess I'm going to have to dash off to another meeting at 3 o'clock, but I hope people have found that session useful from our perspective. The full report on the innovation study will be out in sort of early April. We'll let you guys know, and we'll get it fired out through the MediWales network, if that's okay, Gwyn. And so yeah, I do thanks for the people who've participated today. It's useful to get other people's thoughts on it. Sean, any kind of final words from you?
No, I'm good, thanks, Tom. I found all parts of today very interesting, listening to other people talk and engaging in conversations, this one and the sort of general innovation conversation earlier today. I think it's been great. Enjoyed it.
Yeah, me too. So yeah, thank you, Gwyn, and Debbie and the support team, Katie and Izzy, for everything they've done to get us on today. And we look forward to engaging with MediWales again soon.
Absolutely, no problem. Thank you very much, Tom, and thanks for wrapping it up in a timely fashion. It's a beautiful day out there. Some people might be able to enjoy the sun. Some people might be able to get on with some work this afternoon before they join us again tomorrow for the digital session. Personally, I've got my jab, so I've got an exciting adventure to go to this afternoon. Thanks again, and thank you, Sean. You've put in a few shifts today, so we really do appreciate your input and your wisdom as always. And so it'll be great to meet up with everybody again tomorrow. Thank you.